Welcome. Come on in. Welcome. I'm Dr. Rogers, and this is my colleague, Dr. Lauren, and today we're having a group therapy session because your family members and friends think you have a mental illness. This mental illness is called bipolar disorder, and it changes your moods and as well as your energy and activity levels. There are times of highs, which are called mania, and lows of depression. We will explain the aspects of this condition as well as the causes, risk factors, symptoms, diagnosing, treatment, and coping. The definition of bipolar disorder is a mental illness classified as a mood disorder in which individuals experience episodes of an elevated or agitated mood or in alteration with episodes of depression. The causes of bipolar disorder are not clearly known, but there are three main groups that possible causes fall into. The first is genetic, which bipolar disorder tends to run in the family, and about 50% of people who have a family member who have bipolar disorder are more likely to have bipolar disorder themselves. Biological causes can be a dysfunction of neurotransmitters, which are the chemical messengers in your brain. They send chemicals like norepinephrine and serotonin, which stabilize your mood, and if these are not in balance, it can cause bipolar disorder. Environmental causes can be anything from a life event, alcohol and drug abuse, or hormonal problems. Although alcohol abuse does not cause bipolar disorder, it certainly worsens it.
Risk factors. There are four main risk factors. The first one is family history. So maybe at some point in life of your family history, a person of your family had bipolar disorder. And throughout time, it maybe has passed down to you. The next one is stress. Stress is very bad for you. Stress causes you more to outburst yourself and to harm yourself even more when you are stressed. The next is substance abuse. You shouldn't be using alcohol, drugs, weed, etc., coke, whatever, because that's just going to cause you to even break out more, have depression episodes even more, and it's not going to help you at all. It's just going to make it even worse. And last is major life change. So maybe at some point in your life you lost somebody and that caused you to become depressed. Or maybe somebody didn't do something for you that made you get super angry for no reason, and that's what caused major life change in your life.
So, we'll start with you two. Anthony, tell me a little bit about Zach.
Well, Zach's pretty much a lifelong friend of mine. I've known him for a very long time. He's a good guy. He comes from a good family. But lately, we've noticed he's had a lot of stress in his life, and he hasn't been himself. He's been extremely aggressive. He's been out of control, and he's usually pretty calm and level-headed and has his emotions, under control. He's been making really unusual demands and requests of his family and friends. He gets really aggressive over seemingly trivial things. He's kind of yelling at people a lot, and it's like his mind just isn't really stopping to process information. He's going a mile a minute, it feels like, and he doesn't think about any consequences of his actions at all. So we hope today that by bringing him to this meeting, we could hopefully shed some light on what's going on. And just so you know, Doc, his dad has been diagnosed with bipolar disorder, so I don't know if that has played into what we've been experiencing here.
Whatever, man. I mean, you don't know what you're talking about. I haven't been getting support in my life, so you don't know what you're talking about. I'm fine.
So Zach, how are you feeling today?
I feel fine, I'm doing good. I'm pretty okay. I don't really know why I'm here. I don't really understand why I have to be here, but I feel fine.
You're kidding. You can't think of any reason why you need to be here. I mean, like I just said, you've been acting completely out of character. You have way too much energy all the time. You're aggressive, and you're always yelling at me and your family like I'm getting scared just because you're extremely irritable. You blow up at absolutely nothing in my eyes. So I can't believe that you would actually sit there and say to us that you can't think of any reason why you're here.
Oh, I'm fine. I don't know what you're talking about. I'm here. I'm talking. There's nothing wrong with me. I don't know. There's no reason for me to be here.
All right, Zach, I'm going to ask you a couple questions just to get some feel about how your life's going. How has your sleep patterns been?
Sleep? I don't need sleep. I mean, this past week I've only slept 4 hours. I mean, I'm fine. I'm running at 100%. Like I'm a machine. I'm fine. I can keep going.
I can't believe you don't hear anything you say. You just said you slept 4 hours this week. You think that's normal? You think that's healthy? Your mind just racing a mile a minute. You're speaking just non-stop. No one can understand what you say when you get on these tangents. And you know that you need sleep. It's not healthy for anybody to sleep just 4 hours a week.
Are you home? I'm here. I'm fine. I'm awake. I mean, obviously I don't need sleep. I'm talking. I'm going. I'm fine. I'm fine. I'm running. I'm going. Like, you don't know what you're talking about because I'm running. I'm here. Do I look like I'm not awake? I'm fine.
How was your diet been, Zach?
Diet? Oh man, I'm eating great. I've been eating Doritos and candy, and I'm drinking energy drinks and it keeps my mind going and going, and it's great. Like I'm able to just keep doing what I want to do.
It sounds like you just described the diet of like a 5-year-old on Halloween. You don't make any sense. Like, open your eyes and see the way you're acting. That's not a healthy way for you to be living. I don't know what to do with you sometimes.
Are you kidding me? Are you kidding me? Like, it's just, oh my God, Doc, listen to this, isn't it? I have this great business plan, okay? It's like, I'm gonna sell lensless glasses that glow in the dark. It's gonna be perfect. And I go over to this guy's house at 3 in the morning and I asked him to bring me to Miami to get this business plan set up, and he wouldn't help me. He wouldn't come, and just like this business is gonna be bigger than the moon and larger than the ocean. He won't help me.
That's what you just said. Lens glasses that glow in the dark? Who the hell's gonna want those, okay? You think that you can do anything, you think you can be anyone, you've got no money to do this, you've got no plan, you got no way to get down to Miami, you don't know anybody down there, you're acting completely reckless, and you're not thinking about anything that could happen from the way you're acting.
If you would have just supported me, it would have already happened already. You don't know what you're talking about.
Supporting you? I don't think that getting me up at 3 in the morning to drive you 3 hours to South Florida is anything that you need support for. I'm helping you by not doing that for you, alright? I got a job, I got bills to pay, I got responsibilities, and I can't be getting up in the middle of the night to drive you down there for some ass-crazy idea that you've come up with for glow-in-the-dark glasses.
Zach, don't you think you're being a little unreasonable?
Hell no. How am I being unreasonable? Are you kidding me? This is a great business plan. I'm gonna be the next millionaire. I'm the next Steve Jobs, next Bill Gates, and this guy won't fucking help me. He won't fucking help me. He just cares about his fucking work and he doesn't care. If he would support me, it would have fucking happened already.
If you'd get a job, maybe you could understand where I'm coming from, alright? Stop acting like a crazy person. I don't know how much I can deal with you like this.
I quit my job. I quit my job for this, and you forced. Oh, fuck you, man.
Whoa. Okay. Can we just go on here? I'm really freaking out. So
Sure.
freaking out.
You brought me here.
Well, I
We
mean,
should
there's
just leave. How about that?
no. I mean, we have a reason to be here, and I want
I don't
to try to
think
get
so.
help for you. So
So I'm going to ask you two some questions now. So Jennifer, how's Janelle been acting lately?
well, she's she's really withdrawn. She stays in her room for most of the time. She sometimes gets anxious, and she's gotten more anxious than me. I'm the nervous
She wants
one
me to
around
be
here.
involved in everything in her life. I mean, I know I'm living in her house, but come on, give me a break. Like, I mean, what's wrong with me staying in my room and...
Well,
Like,
I
is
mean,
it-
there's certain stuff. I mean, like, she's staying right now with me. I have a husband and 2 kids, and we just, like, I don't know. They try to talk to her, and she doesn't pay attention, and just, I don't know. I don't know what's going on.
You know what's going on. You know my life sucks right now.
Yeah, but I haven't seen you this way. I mean, just in the past year, you've been acting completely different than how you've
Because
been
in the
before.
past year, a lot of stuff have happened to me. For your information, my boyfriend broke up with me, okay, like a few months ago. And then shortly afterwards, I got let go from my job, okay? So life sucks, okay? So can you just excuse me from like being involved in everything? Do you mind?
You know, I'm going to ask you a couple questions. I hope you don't mind. How are you feeling today?
Well, I don't want to be here, that's for sure. So pretty crappy, I guess you could say.
Well, there's reason why we're here.
I don't think there's any reason whatsoever.
Yes, there really is, and we're going to
You
talk
are
about these
exaggerating.
things.
So, how's your sleep been?
It's been fine. Well, maybe in the past. Well, in the beginning when all these things happened, I slept fine on my own, but then I guess things got kind of difficult, and I had trouble sleeping, so I would wake up at night and I guess anxious, an anxiety attack or something. So I started taking sleeping pills, but I use them carefully, you know, like I'm not.
What do you mean you use them carefully?
Do you mind?
Okay.
Yeah, I use them like a responsible adult, okay? I know what I'm doing.
So, how's your diet been?
You know, I mean, when, you know, some people when they're anxious, they eat a lot. Well, I'm like the opposite. I don't eat that much, you know. I don't know, I haven't been that hungry lately, but, I mean, it's whatever. I still eat, you know. It's
Not really. I mean, she doesn't come and eat with us at the table or anything, and when she does, she just barely eats. She's lost a lot of weight. I can tell from how I see her.
So I don't eat as much as I used to because of what's going on in my life. Is that so wrong? Come on, like, cut me a break or something. You exaggerate. It's not like I'm starving myself. I'm not anorexic or anything. I really have no problem. I should not be here.
Jennifer, have you had any experience with one of her episodes before?
Well, yes. Yeah, well, one of the worst was about a week ago or so. She was supposed to pick up my kids from school, and she just ended up forgetting, and I got home after picking them up pretty late, and was really worried. She was there sleeping, and it's not like her to forget stuff like that.
So I forgot. How is that an episode? You just said it's not like myself, so what's the big deal?
You were just there passed out, and when you woke up, we started arguing and whatnot, and then you started saying really crazy stuff. Like she eventually said like that she wanted to do something crazy, like kill herself in front of my kids or something. I don't know. I don't even know where that came from.
Suicidal tendencies are a serious matter, Janelle. Do you have anything to confess?
Well, honestly, I don't see how dying would be such a bad thing right now, honestly. Like, I know I sound crazy and just you don't get it, okay? Like, my life is horrible right now, alright? You have a perfect life where, you know, you have a loving husband, you know, a great family, you know, kids, and you have a great job, and I'm sitting here, my life is falling apart. I have to live in your house, okay? Like, of course I want to kill myself. I hate my life. I hate myself. I don't understand. I don't see the point in living. I just don't care anymore. You know, I don't see the point anymore to, like, living at all. So excuse me if I want to drink, if I want to take sleeping pills, if I don't want to be with you guys, okay? I'm sorry.
See, why are we fucking here, bro? I mean, I'm listening to these two broads listen about their depressive issues, and I really don't care. Like, what about my business? Are you kidding me? We could be in Miami already.
I've had it with you, man. I'm up to here, alright?
I didn't know that there was
Done
going to be someone
and
like
quit
that.
this.
Like, I'm
This is
sorry.
bullshit, alright?
This is a
We're
fucking
done.
waste of
Calm down,
time.
everybody.
We're
Calm
fucking,
down.
You have to set my business
You're
here,
just
Zachary.
showing, like, to
Anthony.
do stuff like that?
Janelle, please, calm down. My colleague here would like to show you a couple videos of what we think is type 1 and type 2 bipolar disorder.
So I really, I don't know what I'm doing in the video right now because I feel rules. So I really, I don't know why I'm doing the video right now because I feel that's so weird right now, honestly. But I guess I thought that it might help a little bit to just do a video right now because I am experiencing some massively manic symptoms right now, and obviously it's manifesting in a stutter that I never had when I was a kid. I never had a stutter. I never had anything like that. I had trouble making certain sounds when I was a kid, but I never had a stutter. So it's really strange that when I get into like this manic or hypomanic, I honestly don't know what to call it right now. But when I get into this kind of a stage, I start stuttering. I think it's because the thoughts are going into my head way too fast, and they can't come out of my mouth fast enough. So basically, this is what happens when I get manic, and the strange thing is that it shouldn't be happening right now. It really should not be happening right now. I got on Prozac last Monday actually because I was getting some really bad depressive symptoms, and I know I'm bipolar. I realize that bipolar people probably should be on medication. I mean, obviously, looking at me right now, I should be on medication, and I am on medication. And that's the funny thing is that I'm actually experiencing this despite the fact that I'm on medication right now. So this is how absolutely insane this can get. Right now, really, the only thing that I want to do right now is go out and drive about as fast as I possibly can on the freeway. You know, I want to go out and party. I want to dance. I don't know how to dance, but I want to dance for some reason. It's hard to understand how this is actually happening right now because I was fine when I woke up this morning. I barely got any sleep last night. At least I think I barely got any sleep last night. I think I'm having this problem where I'm not dreaming because I wake up, I can't remember any dreams, and I feel so incredibly tired. No matter how much I sleep, I can sleep like 8 hours a night, and I still feel so fucking tired, and it doesn't make any sense. And it really doesn't make any sense that I could have barely slept every night this week, and yet right now my thoughts are racing, my speech is racing, or at least it would be if it weren't for the fact that I can't seem to get the words out fast enough, and it's just driving me nuts. I want to go ahead and do something stupid. I want to. I don't. My brain wants me to anyway, but I can't seem to. You know, it's self-control. I have to be self-controlled. So you know, yeah. This is. I'm sure anybody watching this right now thinks I'm completely insane, and yeah, maybe maybe it's somewhat accurate. You know, I can't keep the computer from shaking because my leg is shaking. This.
So you guys think that he's got type 1 bipolar disorder?
So I believe Zach has type 1 bipolar disorder. As you heard in the video, there's stuttering and, you know, kind of a mood swing. You would be very angry, and then at some point in time you'd be depressed. So at this point in time, I'm going to diagnose you with type 1 bipolar disorder. Now, you seem to be depressed all the time and maybe have an outburst of a mood, being angry, suicidal thoughts, etc. So I'm diagnosing you with bipolar disease type 2. And maybe with this video, you can see what it's like.
Hey, so I'm currently having a depressive episode. A lot of things happened in the last 48 hours. But I think it's just kind of happening anyway. I'm just kind of in a really low spot. My doctor today told me that I was coming off my medication too fast, so I had to get my medication put back up. Because he said my withdrawals were pretty bad, and I have to call him this week if I'm feeling crappy. I had to get a blood test done today. And then tonight was just a big blow up. I'm like, I don't know if this is like a bipolar thing, but like, when you're having a manic episode, like my parents are kind of just like, they don't care about my episodes anymore. Like, they're just like, it's annoying to them. Like, my dad just keeps saying, like, wait, you get out of the house. Even though my work just closed down yesterday, so I don't have a job, and he knows that I have nowhere to go. But, like, I don't know if it's just me, but, like, when you're like this, there's, like, no one you can call. 'Cause, like, no one would understand. I don't know. I think this is the worst I felt in like over a year. I don't know like what's going on. I don't know if it's my fault. My mom said some really hurtful things today, which is like out of character for her, so I wasn't really prepared. It's just been like a lonely day. I'm not feeling good. I don't know. I don't know how to get out of it. The frustrating thing is like the only thing that calms me down is taking my Klonopin. But I don't always want to be sedated. I want to be able to like manage my own feelings. I can't. It's so frustrating. It's frustrating that I don't even know what's like how to calm myself down. Except by taking a pill, but like I don't want to do that anymore. And like my family just thinks that like sedating me is the only option. Like that's not fair. It's not like human. I hate making videos where people see me cry.
So as you can see now, this girl has type 2 bipolar disease. And I am diagnosing her with type 2 bipolar disease because you have major depression issues. And you show signs of type 2 bipolar disorder, which is basically you're depressed all the time, and you might once in a while have a mood outbreak of being angry.
Is there anything I can do? Because that's horrible. I mean, I know exactly how she feels, but am I supposed to live with this? Like, how am I? Is there anything I can do?
Well, there is no treatment for bipolar disorder. It is a lifelong thing that you're going to have to live with, both of you. But there are some things that can help you cope with this disorder. You can always get on medications. Mood stabilizers are very effective. One in particular is lithium. It's the oldest, and it was the first approved by the FDA. This could definitely help you to not have as many outbreaks and episodes. This, along with therapy, psychotherapy, which is just talking about it. Just talk to Jennifer, talk to Jennifer's family, go to a separate therapist.
Yeah, but you saw how that girl, like, no one understood her. It's gonna get old sooner or later. You know, like, she's not gonna care anymore sooner or later. Just
Well,
like
you're my sister, so I'm always going to care, whether you think so or not. So,
I think you need to manage your stress levels. I think you need to exercise. I think you need to get a better diet, because eating Doritos is not good. Both of you just need to talk to your family members, get educated, and start learning how to cope with this.
We all hope that this meeting has been helpful to you. We have talked about what bipolar disorder is, what causes it, the symptoms, and diagnosing you guys. Treatment and ways of coping with it. Though it is a lifelong condition, with the right medication and therapy, people with it can live fulfilling and productive lives.